Welcome to UMCC Medical Consultant Connectors, where your health matters to us. We understand that navigating the world of health information, especially when it concerns your child, can feel overwhelming. Today, we are here to walk with you to provide clarity and to offer guidance protecting the youngest members of our families from HIV. Your decision to seek out this knowledge is the first and most crucial step in safeguarding your child's future. Please take a moment to like this video, subscribe to our channel for more trusted health information, and share this with others who might benefit. Thank you for joining our community today. This discussion is designed to be a safe space. We will be talking about HIV in infants, a subject that can bring up many questions and emotions. Our goal is to replace fear with facts and uncertainty with clear, actionable steps. We will break down what HIV is, how it can be passed to a baby, and what signs to look for. Most importantly, we will cover the incredible medical advancements that allow us to test, treat, and even prevent transmission. Remember, knowledge is not just power, it is also peace of mind. To protect a child, we must first understand the challenge. To protect a child, we must first understand the challenge. HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the body's immune system, which is our natural defense against illness. For babies under the age of 18 months, the primary way they can contract HIV is from their mother. This is known as vertical or mother-to-child transmission. It can happen during 3 specific periods. During the pregnancy itself, as the virus crosses the placenta, during labor and delivery through contact with blood and other fluids, or after birth through breastfeeding, as the virus can be present in breast milk. It's important to state clearly that this is not about blame. It is simply a biological reality we must address. When a baby is born to a mother living with HIV, doctors have a specific way of classifying the baby's situation to ensure they get the right care. Initially, the baby is described as HIV exposed. This term simply means the potential for transmission existed. It does not mean the baby has the virus. The infant carries the mother's antibodies for many months, so a standard antibody test would be misleading. Therefore, doctors use special tests to look for the virus itself. Based on these tests, a baby will eventually be classified as HIV infected, meaning the virus is present, or HIV uninfected, confirming the baby is free from the virus. This careful classification guides every medical decision. Understanding this process helps demystify what happens at the hospital and clinic. The journey from exposed to a final status is a carefully monitored one. It involves a schedule of tests and checkups designed to get a definitive answer as early and as accurately as possible. This is a journey you will not have to take alone. A team of healthcare professionals will be there to guide you and your child through every single test and result. Many babies who are exposed to or have contracted HIV appear perfectly healthy at birth and during their first few months. This is why waiting for symptoms to appear is not a safe strategy. Proactive testing is essential. However, it is still important for parents to be aware of certain signs that might indicate an underlying health issue, including HIV. These signs are often related to a weakened immune system. You might notice that your baby is not gaining weight or growing as expected, a condition doctors call failure to thrive. This can be a subtle but significant clue that something is not quite right with their overall health. Other potential symptoms can include frequent or persistent illnesses, recurring ear infections, persistent oral thrush, a white coating in the mouth, severe diaper rash that won't go away, repeated bouts of pneumonia, a long-lasting fever without a clear cause, chronic diarrhea, swollen lymph nodes in the neck, swollen lymph nodes in the armpits, swollen lymph nodes in the groin. Some babies may also experience a swollen abdomen due to an enlarged liver or spleen. These symptoms can be caused by many other common childhood illnesses, but if they are persistent or severe, they warrant an immediate conversation with your doctor. Because an infant carries their mother's antibodies for up to 18 months, the standard HIV antibody test is not reliable for diagnosis in this age group. A positive result on an antibody test could simply reflect the mother's status, not the baby's. For this reason, doctors use a different, more specialized type of test called a virologic test. These tests detect the virus itself, or its genetic material, DNA, RNA in the baby's blood. This provides a direct and accurate way to determine infection, bypassing maternal antibody ambiguity. The diagnostic process follows a clear timeline recommended by health authorities. First, virologic test, within the first few days or weeks of life. Follow-up testing, around 1 to 2 months. Follow-up testing, 4 to 6 months. Following this testing schedule precisely is paramount. A definitive diagnosis allows for immediate treatment if needed, or provides immense relief and confirmation that the baby is HIV uninfected. Your healthcare provider will create this testing plan and guide you through each step. If a baby is diagnosed with HIV, the medical guidance is clear and immediate. Start treatment as soon as possible. The treatment for HIV is a combination of medicines called antiretroviral therapy, or ART. These are not a cure, but they are incredibly effective at controlling the virus. For an infant, ART works by stopping the virus from copying itself inside the body. That reduces virus in the bloodstream, often to undetectable levels. Suppressing the virus lets the baby's developing immune system recover and grow stronger. The medications are given as a liquid syrup that is easy for a baby to swallow. Dosage is carefully calculated by weight and adjusted as the infant grows. Your pediatric HIV specialist will work closely with you to manage the treatment plan. They will monitor for potential side effects. They will track the baby's progress with regular blood tests and checkups. Giving the medicine every single day, exactly as prescribed, is the key to success. With early action and consistent care, we can protect the vast majority of these precious little lives from the virus. We have covered a great deal of information, and it is natural to feel a mix of emotions. The most important message to take away is one of hope and action. If you are pregnant and unsure of your HIV status, the first clear step is to get tested. This simple blood test is confidential, widely available, and is the gateway to protecting both your health and your baby's. If you already know you are living with HIV, connect with a healthcare team immediately to start or continue your treatment. Your health is the first line of defense for your baby. These are proactive, powerful steps you can take right now. If your baby has been born and you are concerned about any of the signs we discussed, like poor growth, frequent infections, persistent fevers, do not wait. Schedule an appointment with your pediatrician or local clinic right away. Be open about your concerns and ask for their guidance. Early diagnosis leads to early treatment, and early treatment saves lives. Be sure to follow the recommended schedule for all of your baby's tests and immunizations. Consistent follow-up care is absolutely essential for monitoring your child's health and ensuring they are thriving, whether they are HIV exposed or have been diagnosed with the virus. You are your child's most important advocate. Remember, you are not alone on this journey. There are support networks available, from medical professionals to community groups and other parents who have walked a similar path. Ask your doctor about local support services and lean on trusted friends, family, or counselors. Thank you for spending this time with us at UMCC Medical Consultant Connectors, where your health truly matters to us. The science of HIV prevention and treatment has given us the tools to ensure that children can live lives untouched or unhindered by this virus. By taking these steps, testing, treating, and following up, you are giving your child the greatest gift of all, the promise of a healthy future. You have the power to change the course of this story for your family. Please remember to like, subscribe, and share this information. It could make all the difference to another parent and another precious little life. With the right medical care, the risk can be reduced from as high as 45% down to less than 1%. There is so much hope. Let's continue this journey together with UMCC Medical Consultant Connectors, where your health matters to us. Thank you for watching.